Good morning to everyone. Welcome you all to the lecture series by Department of Conservative Dentistry and Endodontics, Ramapuram plant, SRM Training College. I am Dr. Ravikumar. So today I am going to talk about, I'm going to take a topic, access cavity preparation. Okay. What is access cavity preparation? So access cavity preparation is a part of the root canal treatment. So the root canal treatment, nowadays the root canal treatment plays a vital role in dentistry. So nobody wants to go for extraction. If possible, they will prefer go for root canal treatment. So root canal treatment is access. What is before going further? We have to go for definition of access cavity. What is access cavity preparation? Access cavity preparation is nothing but it's a coronal extension of the pulp chamber. Okay, so coronal extension of the pulp chamber from the roof of the pulp towards the occlusal aspect. In case you take imagine as the molar. Okay, so what are the various steps you cannot take? So step one is access cavity preparation. Second step is tooth length is that means the working length, biomechanical preparation, then obturation, then entrance sealing. These are the four important steps to canal treatment. So you imagine this tooth. So what are the parts of the pulp? Pulp has two portions. One is the coronal pulp, which is on the occlusal aspect or the crown portion. The another one is a radicular pulp, which is inside the root canal, which is both are connected with the area is orifice. So this is the area we have to enter for doing the root canal treatment. So what are the various objectives of access cavity preparation? Access cavity preparation, one is going for a straight line axis. So how will you get a straight line axis? Straight line axis is nothing but it's a when you place the instrument, it go smoothly without any hindrance. Okay, so that is the way you have to do the access cavity preparation, starting from the orifice or occlusal table towards the apical portion, that is up to the minor diameter. This is the straight line axis. In case the tooth is curved, means so your instrument should be reached from the orifice towards the curvature area. This is the straight line axis. The second one is locating the root canals orifice. Most of them, what will happen? The orifice of the canal is in the pulpal and the walls. The line angles you can see the orifice. I will show the pictures. Okay. Then third one is conserve the tooth structure. What is meant by conserve? Whenever you are doing a root canal, what we will do? We will remove the caries. Then along with that, we will sometimes for getting the remove the over preparation. That time we are replaced with the material. So whichever the material you are replaced, the damage to, but the strength is lesser than the original tooth. So try to avoid the unnecessary cutting of the dentin to conserve the tooth structure or sound tooth structure. Then move on to the next step is the principles of access cavity preparation. So what are the various steps of cavity preparation is outline form, convenience form, removal of the caries, and defective restoration and cleaning of the cavity. So outline form. So what is outline form? To get enter into the pulp chamber, we also do some amount of the modification of the tooth structure. Okay, to get the orifice. Okay, so that means established by the mechanical projecting the internal anatomy to the external surface is the outline form. Outline form for the various tooth is different. If it's anterior, it is triangle in shape. In case if it's a premolar, ovoid in shape. When it comes to the molar, it's a triangle in shape. So in the anterior, you can see in the picture. So this is the triangle portion. Okay. Here the base is towards the incisor edge. The apex is towards the cervical area. This is for anteriors. When it comes to the premolar, so ovoid or ovoid in shape. This is the thing. It should be your access cavity preparation. What is the main difference between access cavity preparation and cavity preparation for premolar is the access cavity preparation is from the buccal to the palatal side. When it comes to the classroom cavity is from the mesial towards the distal side. This is the main difference. You can see in the way how to do. Okay, when it comes to the molar, it's a triangle in shape. Okay, this is the upper molar. So it has a two canals on the buccal side. One is mesial buccal canal, another is the distal buccal canal. When these two canals, the triangle of the base is towards the buccal side. When the apex is towards the palatal side for the upper molar. When it comes to the lower molar, The base of the triangle is towards the medial side. The apex is towards the distal side. Now you can clearly see this is the buccal side. Okay. MB1 canal, mesio-buccal canal, MB2 canal, okay, disto-buccal canal, and this is a palatal canal. Now you can see one line which connecting these canal is called the dentinal map. Whenever you completely remove the tooth structure or defective portion of everything, in the floor of the pulp cavity or pulp chamber, you can see the dentinal map. Now you can see here also the dentinal map. Here you can see it's connecting. This is the dentinal map. Okay, so these are the dentinal map. So it's connecting the it goes to end in the orifice. Okay. The third step is the removal of the remaining caries. So after once you done an access cavity preparation, you have to inspect the cavity. In case any defective restoration or older restoration or any infective caries, or if possible, try to remove the affected caries unnecessarily. Don't remove the tooth structure. If needed, you remove it. Okay. Why we have to remove it? We have to don't allow any bacteria to contaminate the root canal treatment. That is the reason to remove the existing caries or any old restorations. Okay. What is the final step? After the final step, what is the after the access cavity preparation? We have to remove the debris or necrotic material or remaining pulp tissue with the help of the irrigating solution from the pulp chamber or from the radicular portion for any for the next step for biomechanical preparation. So toilet of the cavity. Okay, remove the debris from the root canal is the toilet of the cavity. So what are the armamentarium used for root canal treatment or access cavity preparation? So it's a two handpieces. One is a contralateral handpiece, another one is a high-speed handpiece. High-speed handpiece is used for access cavity preparation. Contralateral handpiece used with the help of GG drill to remove the shoulders in the palatal aspect of the anteriors. Okay, what are the other instruments? DG16. DG16 is an aeronautic explorer used to locate the orifice of the canal. If you find very difficult to locate the canal with this instrument, because of the sharp point, you can locate the canal. So another one is a round bear or tapered bear or safe and tapered bear. So previously, what we usually do is start the root canal with a round bear, then we end up in straight bear or a tapered fissure bear to complete the procedure. So nowadays, there's some modification they have done. They introduce a new bear, is an endo access bear. Okay, I will show the picture that also. Okay. So now you can see the tip of the bear is a round bear, round. Okay, then you will get a taper. So these two are incorporated this bear instead of doing two separate bears. Okay, it's called endo access bear. Okay. The another bus is endo bear. Okay, you can use it for these purposes. Okay. What is this bird? Transmetal bird. Transmetal bird is a bird used some most of the time what the patient is come along with without the root canal, the patient will have a crown. For that kind of cases, either you have to approach the orifice through the crown, or you have to cut the crown into pieces or remove the old crown. You have to go for root canal treatment. For that time, you have to use a transmetal bird. Okay. What is the ultrasonic instrument equipment? This is the equipment we use to locate the orifice and remove the debris or any obstruction in the orifice with the help of this ultrasonic tips. Okay. What are the latest equipments? So one is the loops, another one is the microscopes. Okay. So sometimes what happens through the naked eye, very low, difficult to locate the canals. That time we can use go for loops. When you put the loop, nowadays the loops comes along with the LED light also. So instead of going along with that dental chair operating light, you can use this LED light to locate the canals. If you want to go for higher magnification, you can go for microscope also. Okay, these are the armamentarium used for access cavity preparation. So how will you do the access cavity preparation? As I mentioned earlier, the access cavity preparation for the anterior is triangle shape. The base of the triangle is towards the incisor edge. The apex is towards the cingulum area. Okay. So this is how we have to do the access cavity preparation. Why it's a triangle in shape? Because the pulp chamber is triangle in shape. That is the reason when you do the should not make a small one do the access cavity preparation and remove the debris because we are not able to remove the pulp or necrotic pulp in the sides. So how to make the triangle? Then only you can remove the all the necrotic tissues from the access cavity. Okay, so once you get the access cavity preparation, so before going further, you have to draw the line, imaginary line on the valvular aspect of the tooth. Okay, so incisal 1/3, middle 1/3, and cervical 1/3. So you have to do the horizontal lines. Okay, another one is how to draw the vertical line. One is mesial 1/3, middle 1/3, and distal 1/3. So we divide the tooth in the 9 parts. Okay, from the 9 parts, so this is the area cingulum. Never disturb this area, because once if you disturb the area, you are literally weakened, because already the tooth is weakened because of the caries. Again, if you disturb this area, there's a more chance of fracture of it. So this is the area mesial 1/3, distal 1/3. This is the middle 1/3, incisor 1/3. This is cervical 1/3. So this is the ideal area for locating the canal. So I have to place the burr in this portion only, in case. In some patients come with a fractured tooth due to any traumatic accident. So no need to follow these routes. Directly you will approach the canal from the incisal area. So next move on to how to do the access cavity preparation. So just imagine the anteriors. So already I told you are supposed to keep it at the center portion. We divide the tooth in the 9 parts, and we have to approach the center area. Okay. This is the area we have to place the burr. So the burr should be perpendicular to the long axis of the tooth. Once you enter into the enamel, the patient doesn't have any complaint of pain. Once you reach the dentine, that time then you have to run the burr, again move on towards the pulp chamber. Once you enter into the pulp chamber, then you have to change the angulation of the burr. So now you have to change the angulation. That means the burr should be parallel to the long axis of the tooth. So this is how we have to do the access cavity. How to do the perpendicular to the long axis of the tooth. Then you have to parallel to the long axis of the tooth. This is the radiographic features of the thing. Once you do like this, automatically this is the area I told you, 2 handpieces we are using. This is the handpiece. This is aerotor. It's a high speed handpiece. Okay. Once you enter into the pulp chamber, now you have to go for a control angle handpiece. Remove the shoulder portion and the overhanging enamel in this area. So this is the area we should remove with the slow speed handpiece. So then you check with the Pathfinder 5. Okay. So you put it like this, then everything goes smoothly without any hindrance. Then you move on to the next step is biomechanical preparation. Okay. This is the access cavity preparation. Thank you. Thank you all.